Basic clinical skills for 6th semester students of the Faculty of Medicine. Basic clinical skills in Semester 6 focus on mastering the techniques and medical procedures necessary for performing physical examinations, handling patients, and using common medical equipment used in daily clinical practice. Below is a detailed explanation of the basic clinical skills learned in Semester 6-1. Physical examination. Introduction to physical examination. Physical examination is a crucial component in assessing a patient's health condition and gathering clinical data required for disease diagnosis. It is performed using inspection, palpation, percussion, and auscultation techniques. Steps of physical examination. Inspection. Observing the external body for signs such as skin condition, body shape, movement, posture, and other visible signs. Palpation. Feeling the body to detect abnormalities not visible, such as swollen lymph nodes, enlarged organs, or areas of tenderness. Percussion. Tapping the body with fingers to listen for sounds, helping assess the condition of internal organs such as the lungs and abdomen. Auscultation. Using a stethoscope to listen to bodily sounds, such as the heart, lungs, or intestines. Examples of physical examination. Cardiac examination. Examining heart sounds, heart rate, and checking for murmurs. Lung examination. Using a stethoscope to listen to breath sounds and detect wheezing or rales. Abdominal examination. Checking for abdominal shape, tenderness, and listening for bowel sounds. Extremity examination. Assessing swelling, pain, or changes in the skin and joints. 2. Anamnesis taking techniques. Definition. Anamnesis is an interview with the patient to gather information about the chief complaint, disease history, family history, social history, and relevant physical findings. Anamnesis process. Patient identification. Asking for the patient's name, age, gender, and other basic information. Chief complaint, CC. Asking the patient what brought them to see a doctor. History of present illness, HPI. Asking in detail about the patient's symptoms, onset, intensity, duration, and factors that aggravate or relieve the symptoms. Past medical history. Identifying any prior illnesses, surgeries, or allergies the patient may have. Family history. Inquiring about any family history of significant diseases such as hypertension, diabetes, or cancer. Social history. Understanding the patient's lifestyle, such as smoking, alcohol consumption, diet, and physical activity. 3. Patient handling skills. Basic management, wound management. Assisting patients with simple to complex wounds, including cleaning, antiseptic application, and bandaging. Medication administration. Understanding how to administer medication in various forms such as tablets, capsules, syrups, or injections. IV and injection procedures. Administering intravenous, IV, fluids and giving injections via intramuscular, IM, subcutaneous, SC, or intravenous, IV, routes. Vital sign monitoring. Checking vital signs such as blood pressure, pulse, temperature, and respiration, and identifying abnormalities in these signs. Resuscitation and emergency care, basic life support, BLS. Providing basic life-saving assistance such as chest compressions and ventilation for patients in cardiac or respiratory arrest. Advanced cardiovascular life support, ACLS. Performing advanced procedures such as medication administration or defibrillation for patients with severe cardiac issues. Trauma management, providing first aid for physical injuries, such as controlling bleeding and stabilizing fractures or joint injuries. 4. Basic medical procedures, laboratory sample collection, blood collection, drawing blood from veins for laboratory tests like complete blood count, blood glucose, or electrolyte levels. Urine collection, collecting urine samples for urinalysis, urine culture, or pregnancy tests. Swab or culture collection, taking samples from wounds, throat, or nasal passages for microbiological analysis, such as detecting bacteria or viruses. Basic surgical procedures. Patient preparation for surgery, conducting preoperative assessments, including physical exams, medical history, and mental preparation before surgery. Wound closure. Suturing wounds after surgical procedures or invasive procedures. Surgical instrument handling. Organizing and providing surgical tools required for a particular procedure. 5. Communication skills with patients. Effective communication. Developing good communication skills with patients. Educating them about their medical conditions, procedures, and treatments. Patient counseling. Offering counseling to improve the patient's understanding of their condition, treatment options, and the importance of adhering to prescribed therapies. Empathy and professional ethics. Demonstrating empathy towards patients and their families while maintaining professional ethics in communication and decision-making. 6. Clinical simulation and practice. Practical training. Engaging in simulated procedures with medical equipment in laboratories or using mannequins to practice clinical skills. Role play. Simulating anamnesis, taking in communication with patients through role play with fellow students or instructors. 7. Patient management in emergency situations. Triage. Determining the priority of patient care based on the severity of their condition in emergency settings. Emergency care management. Managing patients with acute medical emergencies, such as accidents, heart attacks, or strokes. Conclusion. Basic clinical skills in Semester 6 aim to prepare medical students with practical skills required for diagnosing, managing, and caring for patients. Through practical training, simulations, and direct clinical experience, students will gain a better understanding of how to effectively and safely handle patients.